Hi guys and welcome to my channel. Myself Dr. Akshay, and in today's session I'm going to be discussing about the topic central venous pressure and peripheral venous pressure. If you guys want to learn more about the circulatory system, then click subscribe and the bell icon. So let's do this together. Coming to the topic central venous pressure and peripheral venous pressure. So, blood from all systemic veins of the body will flow into the right atrium of the heart. So, the pressure which is exerted by the right atrium of the heart is known as central venous pressure. So, the right atrial pressure is regulated by the balance of two major factors. So the first one is ability of the right atrium and right ventricle of the heart to pump blood from the right chamber towards the lungs. And the second one is tendency of the deoxygenated blood to flow towards the right chamber of the heart. That is, tendency of blood to flow from the peripheral veins towards the right atrium. So there are some factors that can increase the venous return and thereby increase the right atrial pressure. So the first one is increase in blood volume. And the second one is increased large resultant throughout the body along with increase in resultant venous pressures. And the third one is dilatation of arterioles. This helps the blood to flow easily through the capillaries and thereby to the venules and veins. So these are the three factors that increases the right atrial pressure. So the normal atrial pressure is about 0 mmHg, which is equivalent to the atmospheric pressure outside the body. This 0 mmHg of atrial pressure can increase up to 20 to 30 mmHg under some serious abnormal condition, such as in case of heart failure and in case of rapid massive transfusion of blood through the veins. In these cases, this right atrial pressure can increase as much as 20 to 30 mmHg. So the lower limit of right atrial pressure is almost from -5 mmHg up to -3 mmHg. And this range is just below to atmospheric pressure, that is almost 0 mm of mercury. So this -5 mmHg to -3 mmHg of pressure always occurs in the atria when the blood flow towards the atria is greatly depressed. So the right atrial pressure always approaches these values whenever the blood flow towards the right atrium is greatly depressed, and this occurs during serious hemorrhagic conditions. And next, coming to venous resistance and peripheral venous pressure. So the large veins will always have very less resistance, especially when they are distended. That is, this resistance can reach almost up to the value of 0. However, most of the veins after entering into thorax are compressed at many different points by many different tissues. You can see this figure. So this is a vein and this is compressed here, compressed here, it's compressed here. These veins are compressed at many different points. So due to this compression, the blood flow becomes impedant at these points. So here you can see the veins from the arms are compressed by the sharp angulations which are present at the ribs. You can see this first rib, and the angulation from this first rib compresses the vein which is towards his arms. Also, you can see the pressure in the neck falls so low because of the influence of outside atmospheric pressure. So how does this happen? So neck venous pressure falls too low because the neck veins are thin-walled. They are situated above the heart region and they are influenced by gravitational pressures. Also, they are exposed to negative intrathoracic pressure while breathing. Thereby, their internal pressure becomes too low and the external pressure which is present over the surroundings will cause them to collapse. So that's the main reason why the veins which are present in the neck will always have 0 millimeter mercury of pressure. So the veins which are passing through the abdomen are compressed by different organs and also by increased intra-abdominal pressure. So due to these reasons, large veins offer some resistance to blood flow. The pressure at the most peripheral vein of a resting human is almost like 4 to 6 millimeter of mercury, and this is greater than the right atrial pressure, which is almost 0 millimeter mercury. So what is the effect of high right atrial pressure over peripheral venous pressure? So when right atrial pressure becomes greater than 0 millimeter mercury, there will be a backing up of blood in large veins. So this backing up of blood enlarges the veins and also this opens up these collapsed points which I have discussed before. So the opening up of collapsed points occurs whenever the right atrial pressure increases from 4 to 6 millimeters of mercury. So further increase in right atrial pressure can lead to increase in peripheral venous pressures in the limbs and elsewhere. So next coming to effect of intra-abdominal pressure over venous pressures of the leg. So pressure in the veins of the abdominal cavity usually ranges about 6 millimeter mercury in a resting person. But this 6 millimeter mercury of pressure can even rise up to 15 or 13 millimeters of mercury due to abdominal tumors, pregnancy, obesity, or ascites. So when the intra-abdominal pressure rises, the pressure in the veins of the legs must rise greater than that of the intra-abdominal pressure. So this is to prevent the pooling of blood over the lower limbs, thereby helping to prevent these varicose veins and DVT. So what is the effect of gravitational pressure over venous pressure? That's what we are going to discuss next. So the gravitational pressure of a fluid is the pressure exerted by gravitational force over a particular fluid at a particular point of time during equilibrium. So this also occurs in the vascular system of human beings because of the weight of the blood flowing through the blood vessels. So when a person is standing, the pressure at the right atrium of the heart remains at 0 millimeter mercury. This is because the heart pumps blood that attempts to accumulate at that particular point into the arteries. However, the pressure in the veins of the feet of an adult who is standing absolutely still is about 90 millimeters of mercury. And this is because of the gravitational weight of the blood in the veins which is between the heart and the feet. And the venous pressures at the other levels of the body are always in between 0 millimeter mercury and 90 millimeters of mercury. In the arm veins, the pressure at the top of the first rib is almost 6 millimeters of mercury. And this is because of the compression of subclavian vein as the vein passes over the first rib. And the pressure in the veins of the hand is about 35 millimeters of mercury. So if we are calculating the gravitational difference of pressures between the veins of the hand and at this point of the first rib, that is 35 millimeter mercury minus 6 millimeter mercury, it will be 29 millimeters of mercury. So that is the gravitational difference of pressure between the veins of the hand and in between the veins which are present at the first rib. So the pressure in the neck veins of a person who is standing upright will collapse immediately because of the external atmospheric pressure. And this collapse causes the pressure in those veins to remain at 0 millimeter mercury over the entire extent. So therefore we can say the rise of pressure or fall of pressure at this particular point can lead to again falling of pressure back to 0 millimeters of mercury. The veins inside the skull are present in a non-collapsible chamber called the skull cavity. Therefore, they cannot collapse. Here, negative pressures can exist in the dural sinuses of the head in the standing position. The venous pressure in the sagittal sinus at the top of the head is almost negative 10 millimeters of mercury. You can see this is the sagittal sinus and the pressure at this particular point is negative 10 millimeters of mercury. So this negative pressure is due to the hydrostatic suction between the base of the skull and at the top of the skull. So imagine if the sagittal sinus is opened during surgery, this air can be directly sucked into the circulatory system. And this air may even pass downward to reach the heart and thereby to cause air embolism. This can eventually lead to death of the person. So next, coming to effect of gravitational factor over arterial and other pressures. Gravitational factor also affects the pressure in the peripheral arteries and capillaries. For instance, a standing person who is having a mean arterial pressure of 100 millimeter mercury at the level of heart will have a mean arterial pressure of 190 millimeter mercury at the feet level, and this is because of the gravitational factor. So that covers the topic central venous pressure and peripheral venous pressure. I hope you guys learned about this particular topic. Thank you so much guys. See you guys in the next session.